Joining us now is Xi Chen. He's an assistant professor of public health at Yale University School of Medicine. Thank you very much for your time there, Xi. We heard a little bit in that package about what China is doing to encourage people to have more children, extended maternity leave, extended daycare, taking more training for childcare professionals. It's now been nearly a year since China has announced its three-child policy. How has society reacted so far?
Yeah, China has been faced with a continued decline in fertility rate. It's already declined until to 1.3 live births per woman, which is well below the 2.1 children per woman, which is the replacement level fertility. And China has been encouraging more births, especially given the lower number of childbearing age women. This is even more important to encourage more births each woman. But the direction is correct to encourage more children and to release the family planning policy to allow 3 children. So the logic is correct, because when people have a second child, they tend to also love to have a third child because they prefer to have more children. And most of people prefer a larger family, and the children can also provide old age support. But what's changing the dynamic, which need to be considered by the policies, the shift of the burden of childbearing. They need to change that fundamental dynamics in order to encourage women to have more children. So, for example, as the news already introduced the parents' leave policy to allow more days off to take care of children. But beyond that, since children will grow up until age 3, and the most daycares are not quite available in China's society. So the government and the social capital need to be introduced to support 0 to 3 child care. And also, more fundamentally, raising child will have a tremendous economic impact and the economic burden. So, for example, the housing market and also the education, which will be a huge burden to the family. So, promoting more affordable housing and extending education, for example, having extended mandatory education to China's rural and urban children will be very important, and promote equal access to education. So even if the amount of the children will be reducing, but the human capital will be still accumulating. So the decline birth rate may not be a destiny. So there are much things to be done, but it will take a very long time.
Yeah, you're talking a lot about, some of the things that China needs to do to try and encourage people there. But are we looking at a bigger picture issue here that goes beyond policy changes? We're in a world where particularly women, like here in the United States, have an ideological shift, and they want to at least have the option to choose a career perhaps over having a family. Is there a bigger picture here that China needs to look at?
Yes, indeed. And I think and the more fundamental things is about the economic cost-benefit calculations. But beyond that, the whole society needs to promote the gender equity, which is changing the culture and the social norm, which is important for China, for America, for all the countries. So, for example, encouraging husbands to share more housework. So to give more time for the wives to pursue their career. So that will tremendously reduce the cost to women to have children.
Okay, that takes a long time too, but it's certainly a possibility. Thank you very much for your time there, Xi Chen, Assistant Professor of Public Health at Yale University School of Medicine.